Hello, everybody, and welcome. I'll give a couple more seconds for anybody to pop in, and then we'll get started. All right. Rachel, do you want to get us started off with the...
Sure. So welcome everyone. So tonight we are having a session called Ask Anything Contraception, and I'm very excited to be speaking tonight and answering all of your questions about contraception from both a medical and halachic perspective. So my name is Rachel Wienerman. I am a reproductive endocrinology and infertility physician in Cleveland, Ohio. And tonight, I was supposed to be speaking with my sister, who is a Yotzat Halacha. Unfortunately, she could not be here. She's not feeling well, but I am so excited that we have a very special replacement. So I'll let you introduce yourself tonight.
Hey, everybody. Standing in for the incomparable and irreplaceable Sarah Chessis. I'm Rivka Sonnenberg. I'm the Yotzat Halacha and the director of the Canadian Yotzat Initiative. We're based here in Toronto, but we serve Jewish women and families all over Canada and actually globally at this point. And I'm really excited to be here. Mizrahi Canada, who hosts the Canadian Yotzot Initiative, is one of the, and we, the CYI, are part of the sponsoring organizations for the conference. And we are so excited to be part of it. And we're glad you're here.
So we have some questions that we have gathered before the session. Some of you posted questions on social media, and we have some questions that we've gathered separately. So we will start by answering those questions, but we really encourage you to ask any questions that you have in the chat, and we will try to address them as we get them. And if you have any questions that don't get answered during the session, please feel free to reach out. We are always happy to answer them, and we are happy that you have come to learn about contraception. So let me get started. We have some questions that we have gotten. One of the first questions that we got that we thought was really interesting was, are there any oral contraceptive pills that you can recommend for Orthodox women who want to prolong their time between mikveh visits? For example, getting only 4 periods a year instead of 12, and which pills best eliminate staining and breakthrough bleeding? So I thought this was a great question that really kind of gets to the heart of a lot of questions that women have about birth control. So we are going to answer this question from both the medical and halachic perspective, because it had a little bit of both. So I'm going to start by pulling up a few slides that go over a little bit about some of the components of birth control pills. And then we can talk a little bit about some of the considerations. So first of all, just so that people have a little bit of a background, there are many contraceptive options. And there are many situations when contraception may be recommended for a couple where, you may decide that it's for your use. And there are different halachic statuses of all of these contraceptive methods. That's not my expertise. So that is something that obviously you should discuss with your Yotzat Halacha. But the different options are combined hormonal options, progesterone-only options, IUDs, and there are some barrier methods. Now, our first question is going to be about combined hormonal options, the most common of which is the birth control pill. So let's go to talking about the birth control pill. So birth control pills have two components. They have a progesterone component and an estrogen component, and they typically work by both preventing ovulation and also by stabilizing the uterine lining. And those two things are very effective at preventing birth control, but the combination of the progesterone and the estrogen can work together to both cause side effects and also affect the bleeding profile that's very important for women who may not want to get a period every month or who may have breakthrough bleeding. So this is a chart that I put together last year for any of you who came to our session this year, but I think it's really helpful, that goes over some of the common estrogen and progesterone, what we call combination birth control pills, that shows you that there are lots of different pills that have different amounts of estrogen and then different types of progesterone components. And the dose of the estrogen matters, as well as the type of the progesterone. So the higher the estrogen component, the less likely it is to cause breakthrough bleeding, but the more likely you are sometimes to get some side effects like nausea. Some women, for example, with PCOS may want a higher birth control pill, a higher estrogen pill to prevent things like acne that come with PCOS. And sometimes the higher the dose of the birth control pill, it can allow you to go longer without getting a period. So the initial question is, what's the best pill that I can take for, only getting a period 4 times a year? Well, the one that's marketed for that is called Seasonal. So it's actually, that is how it's packaged, that you only get a period every 3 months. But really, any birth control pill that is a continuous pill, meaning the dose doesn't change, that has a higher dose of estrogen, like around the 30 or 35 micrograms, you can do it with. It's harder to do it with an estrogen that's lower. Now, some women who are on a very low dose estrogen, like the low estrogen, it's only 10 micrograms, or this low estrogen 24 that actually has 24 active pills, will not actually get a withdrawal bleed, even if you take the placebo week, because the uterine lining is so thin. So you may not get a period, and that's okay. That's not a medical problem. So you may find that you don't go to the mikvah even if you have that withdrawal bleed. But for patients who want to reliably only get 4 periods a year, we typically recommend one of these higher dose pills that you can program by only taking the placebo week, when you want to, for example, every 3 months. Now, from a halachic perspective, I wanted to ask our Yoetzet to talk about, what's the difference between staining and bleeding and how that might play into a role when you're choosing a birth control pill. So I'm going to pass it over to you, and I have a slide for you.
All right, thanks so much. So it sounds like there are a lot of options, but in all the options, we have to sort of consider the balance between a stable uterine lining and a good solid withdrawal bleed, so that we're not constantly spotting all the way through. That is really the fear, or the most dreaded side effect is the constant spotting. So it's really, really important to understand that not all spotting is going to make you a nida. Many holy women believe that as soon as they see any blood on their underwear, on their toilet paper, in the toilet, on their leg, that they're immediately must be, go become a nida and wait the 5+7 and go to the mikvah. And that's not always the case. And it really depends. So first of all, let me exclude anything that we would consider a flow of blood. Okay. I'm not talking about a flow of blood. I'm only talking about spotting. So it's a little bit tricky. There's no real halachic guideline that tells us when we've moved from a flow to spotting. We usually use rules of thumb that women feel comfortable with. So do you need to put in a pad, or are you okay just sort of making it through the day? If you were to stand over a white towel for 15 minutes, do you think you would for sure see something in that time? Or maybe yes, maybe no. Does it soak through the gusset, the crotch of the underwear, and go through to you can see it from the underside? Is it an amount that's larger than a credit card or half a dollar bill? Like, those are all sort of rules of thumb. There's nothing really halachic about them, except that that's what most women would define as being the boundary, being the threshold between spotting and a flow. So we're not talking about a flow. We're not talking about anything related to that. But if you just see something that's spotting, so it's less than that amount, it's manageable on your underwear, or you maybe need one of those little schmengy panty liners, but you don't really need a pad, you can get through it, then we have to ask ourselves 5 questions, okay? There are 5 criteria which would render a woman a nida in a case of spotting, where there's absolutely no flow and there's no hargasha, which we're going to talk about in a minute. So the first question is color. What color is it? Because don't forget, there's a whole bunch of chemistry going on in your body all month long, and not every color of discharge is necessarily dam nida blood. So just like in our own period, when we say, oh, this is my period, and then at some point it becomes this like brownie, rusty brown, brownie, beigey brown, and then we say, no, that's not my period anymore, that's just discharge. Halacha also has a time or a color on the spectrum when they say this is Nita blood and this is no longer Nita blood. So it's just a question of knowing where that boundary is. And sometimes, depending on the timing of your period, you may never see that spectrum. You may never see that range, because your period will, end during the night. You wake up in the morning, everything's totally, beige or white. But sometimes if you can see over the course of the day as the color changes, you'll realize that there is a spectrum, there is a range of colors. And at some point on that range, we're going to say, okay, that's no longer Nita blood. So just because you see discharge, even color discharge, don't panic. It depends. Some colors are problematic, some colors are not. And I always tell women, when you have a lot of questions and when you have a very exciting hormonal life, it can be really, really stressful. But honestly, you're in better shape than the women who've been on the pill for, the past 15 years. And then they really don't know their bodies. They don't know colors, and they're much more nervous. They're much more anxious about it. So having a lot of questions can be stressful certainly as a young married woman, but ultimately it's in your best interest. And I see those women are just so much more confident in later years. In any event, the second question you have to ask yourself is, what size is it? Because even if it's a problematic color, if it's less than our threshold size, then it won't render you Nita. And again, we're only talking about something that's an external stain. So the size that we generally define as our threshold is called a gris. And a gris is a kind of bean, and it made a lot of sense in the times of the Gemara. Everybody knew approximately what size that was. Nowadays, we say it's about the size of a penny. It's a circle with a diameter of 19 millimeters. Now, first of all, it never falls in a circle. That would be too convenient. But the other thing I want to say is that, in Canada, actually, we've done away with the penny. And often when a woman will ask me a question, I'll say, well, could you put a penny beside it just for reference? And they'll say, I don't have any pennies left in my house. I don't have any pennies to put there. So I think, we think a gris or a bean is like a weird measurement, but in a generation or two, they'll think a penny is weird. So it's somewhere around that size, which hopefully is still familiar enough, even in Canada. And don't forget that even though it's a problematic color, it still has to be a problematic size. Number 3. What color is the material that it's found on? So you find it on your white underwear, you find it on your green couch, you find it on the blue bed sheet. All of those are different. The only color that will allow a stain, a ketem, to render you a Nita is white, for a number of different reasons. Don't forget that the halachot that we follow today, the laws and the guidelines that we follow today, have come through a whole, funnel isn't the word, but they've come through a process from a number of different areas in Nida, in the laws of Yoledet, in the laws of Azava, in the laws of Taharot. And so we have leveled the playing field so that no matter what happens, we know exactly what to do about it. When you see something on a white background, which is larger than a gris, and is a color of dam Nida, the color of blood, halachically blood, then we're up to question number 4. Question number 4 is, what is the material? Even though it might be white, it's possible that it is not mikabel tuma. It's not capable of becoming ritually impure, becoming tummy. And in that case, it would also not render you a Nida from tummy. Having said that, I do want to mention that many poskim, many halachic decisors will say that if you have a spot that is a large enough size of a problematic color on a white background, even though it is synthetic, it could be, polyester or whatever, that because it was right up close to your body and it was white, and then they would still be stringent on that. But generally, Nishmat's poskim would not be stringent on something that is a material that is not makabel tuma, so a synthetic material. And then the last question you have to ask yourself is, could it be from something else? Could I have scratched myself? Do I have hemorrhoids? Do I have a UTI? Could I have, broken a blood vessel? Could I have scratched myself doing a bedika? And a million other things that could be going on. And if there is something reasonable to attribute it to, then of course we're going to take that into account. So just because you see spotting, just because you see discharge, don't panic. Remember that there are a lot of criteria that we have to meet, a lot of thresholds we have to meet before it will make you a Nida. That's spotting that is absolutely not a flow and does not involve what we call a hargasha. A hargasha is a sensation, and halachically, a sensation can be one of 3 things. It's either an all-over shuddering or trembling, almost like chills, but without the fever. It can be feeling your uterus dilate, feeling your cervix dilate. Or the third thing, and most women don't identify those 2, but the third thing, if you are one of those women who's really in touch with her body, you might feel this third one, and that is feeling an internal wet flow. I'm talking about something from the uterus into the vagina. Once you feel dampness on your underwear or something on your thighs, that's a separate issue. It wasn't a hargasha issue, okay? Now, anything that involves a flow of blood, we say that's an expression of the Hargasha, and we make an assumption, and that's all great. That's all nice and tidy. We tied it up with a bow. But what about these three scenarios here on the right? When we have something else going on in that region, we can't be 100% sure that there wasn't a Hargasha there and it was masked by something else. So anything internal, a badika, a tampon, you put some toilet paper in there, your finger. I just wanted to check. I want to see what's going on, but don't worry, it was just a tiny little spot. Anything internal, we have no leniencies. These five criteria, these 5 questions only apply to something external. So anything internal, we have no leniencies. Do not be putting in a tampon. Do not be doing extra badikas. Do not put anything internal, because no matter how small it is, we have none of that threshold. So if it's a problematic color and it came from inside you, it's absolutely going to be a situation where we're stringent, because maybe there was a Hargasha involved, and we will never take a chance with a Hargasha. Number 2, immediately after urinating, if you go to the bathroom and you wipe right away. So halachically, when you find the blood is when it happened. So if I go into the bathroom at work at 3 o'clock and I see, oh my goodness, look at that, my underwear is full. It must have started at 1:25, right? No, when I saw it at 3 o'clock is when it happened halachically. So let's say I urinate and then I wipe immediately. Then I have to wonder, maybe the blood was found during the time when the sensation might have been masked. What if I was urinating and then I texted my friend and then I did the Wordle of the day and then I wiped? Okay. What if it was like 10 minutes later? What if it was an hour later? Do I have to say, oh, maybe when I found it was Hargasha? So what is that threshold between when I finished urinating and when I wipe that I can say I don't have to worry about that potentially masked Hargasha? So of course, there's a range of opinions. Nishmat's position is generally 15 seconds, or at least something, some sort of gap. We aim for 15 seconds, but even if it was a little bit less, that's generally okay. That's for Ashkenazi women. For Sephardi women, they're generally more lenient on toilet paper, and so even the barest minimum of a pause, or even not a pause, is generally okay for Sephardi. But again, it really depends on your posik, it depends on your halachic decider, so you just need to know where you stand, and again, intercourse. There's something else going on in that region, so please just wait 15 seconds if you can after your withdrawals to wipe, because it really separates it from a potentially masked Hargasha, which is a Torah, a biblical doubt, in which case we'd have a mandate to be stringent, to a rabbinic doubt, in which case we have a mandate to be lenient. And that's a huge, huge difference in your life. All right, I've just talked a lot, but I hope I've given you some sense, at least of the questions to ask, and at least of why it's so significant, and why your yoetzet is always asking you, okay, but did you wait? And what did you find? And when did you find it? And how did you find it? And what did you feel? Those are all the considerations that we are trying to ascertain, because it's so vital in understanding what the halachic status is in your particular case. Rachel, I pass it back to you.
Yeah, I think that's really important. And I think that, hopefully that first question can really set the stage to understand, why choosing a contraceptive option can be a lot more challenging for an observant Orthodox woman than for a typical woman, because there is not just the contraceptive efficacy that you need to take into account. And there are other medical conditions, right, that may play a role in how you choose that. And some of the other questions that we have will address some other options. But it's also the halachot of nida and other halachot surrounding it that may influence how you utilize your contraception. So one important concept to understand is, just like we heard, always talk to your yoetzet, because it's very complicated, and what you assume is nida may not be. And so, when there's issues that come up with bleeding during contraception, make sure that you're actually following halacha and not being overly strict with yourself, so that you're not putting yourself into nida when you don't have to. And then the second is talk to your doctor, because there are ways that we can help you with your contraception and minimize spotting and bleeding, so that it is, not as bothersome for you, and also not as halachically problematic. So, when we're talking about birth control pills, for example, we have a lot of flexibility in types of birth control pills that can help minimize spotting. Now, sometimes spotting and bleeding are part of the pill, and sometimes it takes some time to adjust to it. But, doctors also have the ability to say, double up the pill for a few days, add some more estrogen, try different things to try to reduce bleeding if it's really bothersome, or even try different pills. So a lot of questions that people ask are, how long do I have to try a pill before I switch? How common is bleeding? So, these are very common questions. Bleeding is very common. We do recommend that women stay on a pill for generally 2 to 3 months before switching. But typically, if the bleeding is not stopping, I will have patients either try to double up pills or, add estrogen for a few days to see if that can decrease the bleeding. And typically for women, where bleeding is an issue, I may consider a higher dose birth control pill because that can help stabilize the lining. So I think it's really important to understand that the dose and type of the estrogen and then the type of the progesterone both have an impact into how that bleeding profile is going to affect the woman. So I think we can move on to our next question, which was, what are some so this is actually a really good question. I'm not able to use any contraception that contains estrogen. What are my options for progesterone-only birth control options that work well with Taharat HaMishpacha? So I thought that was a great question too. So we actually have some really nice information about progesterone-only options. Okay, perfect. So there's 2 hormones that are mainly produced in a typical menstrual cycle. All right, estrogen is typically produced in the first half of the menstrual cycle before ovulation. Progesterone is typically produced after ovulation. These are natural hormones that are produced in a woman every month. When we give contraception, we override the typical process of ovulation in order to either decrease ovulation or stop ovulation. That's how the birth control pill works, or to prevent pregnancy in other ways. Progesterone-only contraceptives can work either by stopping ovulation or by preventing the egg and the sperm from meeting in other ways, such as decreasing the ability of the sperm to move through the fallopian tube, thinning the cervical mucus, or keeping the uterine lining really thin. So depending on how the progesterone birth control works will affect the bleeding profile. So there are many different options, but they will impact bleeding. And so some of them are preferable for women who are observing Taharat HaMishpacha. So one option is the progesterone-only pill, or what we call the mini pill. It's not the most effective contraception because it has to be taken the same time every single day. And so we typically recommend it for women who are breastfeeding or who have subfertility for other ways. And it can cause spotting because it doesn't consistently suppress ovulation. However, there is a newer progesterone-only pill. It is a progesterone called drospirenone, and the brand name is Slind. Actually, Rivka and I were just talking before the session because it is approved in the United States. I don't know if it's approved in other countries, but it is a better progesterone-only pill for spotting and bleeding. So for women who cannot tolerate estrogen and who have had spotting or bleeding on the typical mini pill, it is a really good option. And it does more consistently prevent ovulation. And so the bleeding profile is better. And you take it just like you would a typical birth control pill. So you actually take it for 3 weeks and then stop for a week, and then you do get a period. So it is a typical birth control pill and that you cycle every month, but you have more predictable bleeding pattern. So for a woman who cannot take estrogen, it's a really great option. It's sometimes a challenge to get it covered by insurance. But if a woman has had problems with the other mini pill, then it can often then be covered. But that's called Slind. It's another good progesterone option. Now, there are many other progesterone options that are not pills. One is an implant called a Nexplanon. I typically do not recommend this for women for whom bleeding profile is a concern because the bleeding profile is very unpredictable. Depo-Provera is a long-term injection. Many women can have no period on this, so it can actually be a very favorable bleeding profile. It is a little bit unpredictable, and it's a very long-term contraceptive. So it's every 3 months you get an injection, but the return to fertility is a long time. It can be up to a year after stopping. So that's a consideration for people who may want to do more short-term contraceptive. Not something that I typically recommend, but it can be a good option for certain patients. And then IUDs, there are progesterone-only IUDs, and that can be a really good option, especially for patients who don't want as much hormone in their body, because the IUDs tend to be more local, and the progesterone IUDs tend to have a good bleeding profile, although they can be associated with spotting, and that's something that Rivka and I had talked about before on our talk too. So
Absolutely.
good progesterone options. Do you want to comment at all about any of those options?
Yeah, I was going to say that the reason we spoke about it is that, all the women who are happy with their IUDs are not calling me to let me know that it's going really well. I'm getting calls from the women who are spotting for months at a time as their body adjusts. And what I found really wonderful about Rachel's approach is that she was really open to playing with it, right? Rachel has the training to adjust and to understand what exactly is going on with the hormones, with the ovaries, and be able to respond. Where I find, and I don't know if this is a Canadian US thing or just some of the women I've spoken to, find that their doctors are very resistant, and they tell them very aggressively, this is a religious problem that you're having, and I don't feel any need to give you any more hormones and endanger you medically just to solve a religious problem. Let the rabbi solve it for you. Whereas I think that really your doctor should respect your lifestyle choices and should respect your decisions and your religious needs. And so if you can find a wonderful doctor like Rachel, then you're in better hands, because you don't have to give up on an IUD. You don't have to give up on a method that is best suited for your medical history just because there's spotting and your doctor refuses to address it as a real need, right? Because and I understand the doctor feels that her job is medicine and the rabbi's job is religion, but you can see here that they overlap very, very intimately. So.
Yeah, and actually, we got a lot of questions about IUDs, so maybe we can address some of those next. So, the IUD comes in a lot of different varieties. So the progestin IUD is, basically an IUD. It's an intrauterine device. It goes into the uterus typically for up to 5 years, and it's embedded with progesterone. So it releases a small amount of progesterone every single day. And the nice thing about it is that it gives a lot of hormone directly to the uterus. So it has a very direct effect on the uterus and not that much into the blood. So for women who really have a lot of problems with hormones, they get a lot of side effects, say from the birth control pill, they can't tolerate it due to medical conditions, or it just doesn't make them feel good, then the progesterone only IUD is a really good option, because you don't get that much hormone in the blood. So you don't really feel that you're taking all those hormones, but the effect of the hormones is very strong in the uterus. So it's a very effective contraception without really overloading the body with a lot of hormones. From a NIDA perspective, it can be really good because a lot of women don't get a period at all with the IUD once you have it in place. And so the bleeding profile actually can be really favorable. The challenge becomes when you first get it placed. It can take a while to reach that steady state, and some women do get spotting. So the question becomes, how do you approach spotting when you have an IUD? So for some women, that spotting is going to be continuous, and it may make it not an ideal contraceptive. But there are things that doctors can do. The reason that the spotting happens typically is because the endometrial lining gets very thin with the progesterone-only IUD. And sometimes you actually need a balance of estrogen to stabilize the lining to help prevent that breakthrough bleeding. So sometimes a doctor may be willing to give a birth control pill on top of the IUD for a short period of time to stabilize the lining, or even a different type of progesterone hormone like Provera. We also use a medication called Agestin to help stabilize the lining for a short course. So those are some suggestions that I've used in my practice for patients who have a lot of bleeding on the IUD. It can really it can really be helpful. One question that Rivka had when we were talking is, how can a short course of hormones like that really affect long term? How can you take hormones for 3 weeks or a month and that really affect your bleeding profile? And the answer is that, your body just needs to get used to these hormones. And if your uterus is having a hard time, shedding the lining because the IUD is in place, sometimes even like 3 weeks of hormones can stabilize it, and then it can get used to the IUD, and then you might actually have a more normal bleeding profile, for the next 6 months. So sometimes, you can actually do something easy like that can actually make the bleeding profile better. So I think having a good relationship with a doctor who does understand your needs is really important. And you can even bring those suggestions. You can say, well, could I try adding a little bit of estrogen if it's not contraindicated, to help stabilize my lining? I think is a really good suggestion. Now, we did get a couple other interesting questions about the IUD that I thought we could ask Rivka. So one question that we got was, some people do get very light periods every month with the IUD. So that's very common. So, the IUD does not reliably prevent ovulation. So when you have an IUD in place, it keeps the lining really thin. For some women, no period at all. Some women will continue to ovulate and get periods, but they are typically very light. The question from a halachic perspective is that considered nida if it's really just spotting, but they get it every single month at the same time?
That's a great question, and it's actually, you're right, a very common one, because you do find women, once they've settled in, that they're either getting random spotting, sometimes every few months, sometimes not, sometimes another 3 months go by, 5 months go by, but there are women who are getting regular spotting every month, but it's never more than spotting. And here there's a range of halachic opinions. So there are those who hold that is your Mirena period. It comes every month, and that's what your new period, your new normal is like, and they would treat that as a regular nida experience. The poskim of Nishmat's halachic decisors do not hold that way. They distinguish between a flow and spotting. Always, always, always. There is no regularity. There is no assumption of a flow when there isn't a flow. So when you're in a situation where you're constantly seeing spotting, as long as it remains spotting, so exactly what we said before, the 5 criteria, if it remains and it doesn't meet the thresholds, then you would not become a nida, and you would not need to worry about it next month. Having said that, the one thing that I would say is that even in a case where a woman is spotting and she's not becoming a nida, we do recommend, halachically, there's no almost pregnant or a little bit pregnant. Like halachically, you're either a nida or you're not. But we do recommend, as an eitzah tova, just good advice from your girlfriend, that if you are spotting, that you abstain from intercourse for 24 hours. Generally, within 24 hours, it either resolves into a bonus period or into, it was some hormonal fluke and it's gone and it moved on, and you can move on too. So there's no need to do any bedikas, any internal checks. There's no need to change into any different colored underwear. I would change into your light colored underwear, but stay in colored. There's no need to become a nida from spotting. And if there's something going on, you will find out. You're not going to miss it, on your green underwear. But it allows you to see what's going on medically without putting yourself at risk of becoming a nida unnecessarily. So we always recommend for 24 hours since the last spot, don't check anything. You don't need to look at your toilet paper, but you're going to be really vigilant about waiting 15 seconds before wiping. You're going to be really vigilant about staying in colored. And if in 24 hours you haven't seen anything new on your yellow underwear, then we assume that it passed and you can move on. And if there's something going on, you'll generally know about it by then. There's some questions also that came in our chat, but I think we still have some from the Instagram.
Well, there's a couple more IUD questions that I wanted to get to, and then I think we can get to the chat. So one question that we had about the IUD is, does IUD placement itself make you nida?
That's a great question. And again, a range of opinions, because we're Jews. But again, Nishmat's position is that as long as the IUD was inserted, she wasn't a nida before, there's no blood coming out, the doctor uses a tenaculum, which is those little pliers to sort of grab the cervix and put it into place. And then for about 24 hours after insertion, there's some bleeding. We generally attribute that to a makkah, to a wound, to physical trauma from the insertion. if it extends, and generally one of the best things that Nishmat has ever done for women is to post the, I think it's called questions to ask, or information to provide after a medical procedure, a gynecological procedure. I can't remember what the title is, but go to jewishwomenshealth.org, go on the sidebar to gynecology and find the questionnaire for after a gynecological procedure, because you will not be able to get back to the doctor. You're going to call the secretary. The doctor's only going to be working there, every second Tuesday. And you're like the 30th patient, that they've seen. They're not going to remember all the details that your yoetzet or your Rav is going to be asking you. So please bring that form with you. It's a lifesaver. And if the doctor tells you, yeah, you can expect, a day of bleeding, or you're going to see some brown discharge from the antiseptic that I used. So when you see that, that's what you expected and that's what you attribute it to. But if you're gushing blood for 3 days, then it's probably a hormonal response and not the IUD. So it's really, really important to get the information that you need from your doctor. It's really important to have a great relationship with a great doctor, so that you can understand where you stand status-wise. A lot of people ask also about removal of the IUD, and again, the Nishmat post-game hold that the bleeding that you would see again within 24 hours after the removal would again be due to trauma from the removal, so it would not render you a NIDA.
Great. And then, another question that we received before the session that I thought was really interesting, someone had mentioned that she has the IUD and she doesn't have any bleeding, and it actually makes her feel kind of strange because she doesn't do mikvah, and she doesn't, I don't know, she's not sure how to feel about that because, she feels weird that she doesn't do that mitzvah. So I just wanted to know your perspective on that.
It's a beautiful question, and it's actually a question that I've heard in a number of contexts. I've had women who are menopausal who feel really sad and miss the mikveh. They miss that rhythm. I've had women who are nursing and haven't had a period in 2 years say that they just sort of feel they just sort of feel at sea. They don't have that rhythm that to steady them and to sort of anchor them. And absolutely, I could see that also with the IUD. So some women, first of all, are really happy about it. And it's important to realize that there's no mitzvah to become a NIDA. You don't get bonus points for becoming a NIDA more often. It is a mitzvah to respond appropriately when you are a NIDA, but there's no mitzvah to become a NIDA. You don't get bonus points. So that's something that's important to realize. But I think the key piece here in all those questions is to identify what is it that you're missing. Because for some women, they're missing the rhythm of the back and forth. They're missing the longing that they feel, and then the reunion when they go to the mikveh. And for some women, they're missing the sort of the sense of ownership and being intimate with their own body. For some women, they're missing the spiritual experience of the mikveh itself and the connection, just them and God standing there, being reborn. It depends what it is that you really connect to, because when you figure that out, you can find that in your marriage in other ways, right? So, just as an example, many women and men go to the mikvah on Erev Yom Kippur, the day before Yom Kippur, right? And apparently there's some other holidays as well. So that would be an opportunity, even though, you don't need to halachically prepare and you don't need to do the whole 7 clean days, et cetera, it still could be an experience of mikveh that could be really precious and meaningful to you. If it's the rhythm of the distance and the reunion that's important to you, again, there are ways to create that in your own marriage in a way that can really enhance your experience and still, medically and halachically keep you where you need to be, where you are.
Yeah, great. We did get a question in the chat that I think is interesting. So someone asked, what is a good option if you're thinking about only being using it for about 6 months, and if you have a bad experience with other medications? So I think that's a really good question, and I think it's a really common question. Couples may only want short-term contraceptives, and then they may want to conceive. So I think when you're looking at options, it is really important to take into account what your fertility goals are when you're thinking about contraceptives. And in general, I would say, the contraceptives I would not recommend if you're thinking you're only going to use it for 6 months would be something that gets implanted, like a Nexplanon, a Depo-Provera. An IUD, typically I'd recommend if you're going to use it for a year or longer. You could consider it for 6 months. It's just a lot to put in for such a short period of time. So in that situation, I would say a birth control pill is a really good option. If you've had a bad experience with a birth control pill, had a bad experience with a mini pill, I think the new Slynd is a really good option for women to try, because I think that it kind of has a lot of the benefits of a typical birth control pill, but it's progesterone only. And then the other thing that I think a lot of women should consider, if you have had a bad experience with the birth control pill, you have to figure out why, is the NuvaRing, which is a combined contraceptive ring, which is about that big, that goes in the vagina, stays in for 3 weeks or longer if you wanted to, and you can take it out. And the NuvaRing actually has a lot of the benefits of the birth control pill, but a lot of women actually find the side effect profile to be different. They may not get as nauseous as they do with birth control pills, or they may find the bleeding profile actually is better. And the reason for that is that the birth control pill, you take it orally, so it has to get metabolized by your liver. That's why you can sometimes get some side effects. And the amount of estrogen that you get from the pill is very high when you first take it, and then it drops. And then when you take it again, it's very high, and then it drops. When you have the ring, you put it in, it actually gets absorbed directly into the blood. And the amount of estrogen and progesterone that you get is a constant, steady stream, because you're not taking a pill. So the levels aren't going up and down. So actually that can make the side effect profile better, because you're not getting these constant up and down of hormones. And it can make the bleeding profile better for the same reason, because the uterus is getting that constant steady state of hormones. So I actually think the NuvaRing is a really good option to consider for people who have had a bad experience with birth control pills. And, some people I think are a little hesitant to consider it because it's the same hormones, but I actually find that patients do a lot better with the NuvaRing if they have it like the birth control pill. Not everybody, but some. So I think that's a really good option for short-term contraception.
Can I jump in and say something about the NuvaRing? Halachically, is that because it's actually physically present in the vagina, and there are many halachic decisors who feel that it can interfere with your ability to do a thorough bedika. And so it has to come out for the hefsek tahara for 1 bedika on day 1 and 1 bedika on day 7. If for whatever reason you forgot to take it out, absolutely ask a shaila. There is some room because of its halachic status, but also it should come out for the tevila, for the mikveh, for the immersion. So that's something to think about. And again, if for whatever reason you forgot it in, you forgot to take it out, etc., that's something that you can, ask a shaila before you run back to the mikveh. But it's something to certainly try when you're there to remember. So you want to take it out for the hefsek, for 1 bedika on day 1, 1 bedika on day 7, and you want to remove it for the mikveh immersion. So good. So we need to, beautiful questions. Do I need to look at it? There are 2 more questions here. Do I need to look at it when I remove or replace it? During your Shemakiyim, when you're taking it in and out, you should look at it. But as Rachel said, you could use it continuously. So you could put it in for 3 weeks and then take it out, put in a new one for 3 weeks, then take that out, put in another one for 3 weeks. Just like you double up on the pill packs, you can double up on the NuvaRing. And in that case, if you're not during your 7 clean days, you have no obligation to look at it. Take it out. I have a woman tells me I only go to the bathroom in the dark now, so I never turn on the light. So you have no obligation to look at it. If you need to, keep the light off, put it straight in the garbage, put a new one in. Make sure you wash your hands and before looking at them. And can you skip the ring-free week? Absolutely. Same as the pill. There's no mitzvah to become a nida every month. It's really a mitzvah to act appropriately, to respond appropriately when you are a nida.
Yeah, and someone asked a question too about the birth control pill. And yes, you can definitely skip the placebo week. So one of the nice things about being on the birth control pill or the NuvaRing is that you do have some control over when you have bleeding. So that can be really helpful for women if, you need to plan, when you might be NIDA, when you might have bleeding. So occasionally, going for a long period of time, you may have spotting if you don't get it. A lot of women find they have to give themselves periods at least every 3 months to maintain a normal bleeding pattern. But if you need to, if you typically like to get a period every month and then you want to, skip for 1 month, totally fine. If you don't want to get a period at all, you can try not taking the placebo week at all and see how long you go before you get breakthrough spotting. There's no reason why you have to take the placebo week from a medical perspective. I would just obviously make sure that you run it by your doctor, make sure your doctors agree. But there is typically no reason from a medical perspective why you need the placebo week. It's really just there to ensure that you're, a lot of women want to see that regular period as like a reassurance. But obviously from a halakhic perspective, there's some reasons why women may not want to get a period. So that is something to discuss with your doctor. There's other reasons why you might not want to get a period too from a medical reason. Some women get a lot of pain with their periods. Medical conditions like endometriosis, we often will tell women to skip their placebo week. Another question that I got was, are there any hormone-free options for birth control? And I think that's a really good question. And we do have some hormone-free options. They really are two main categories. So let me skip ahead of my slide. So, one is the hormone-free IUD, which is the copper IUD. So that is probably our best hormone-free contraceptive because it is completely hormone-free. It's just a copper IUD. It sits in the uterus. It's extremely effective. From a medical perspective, it's a great contraceptive. From a NIDA perspective, even from a medical perspective too, it causes heavy, prolonged periods. So I would say this can be problematic for some women from a NIDA perspective. And, Rivka, if you want to speak to that, but I would say from a medical perspective, this is a great hormone-free option, if the bleeding does not become problematic.
Yeah, so I would say the same thing. And for some women, it's really difficult to have long drawn out periods and to have, because you have no hormonal component, you really have no control over the cycle. So you might be having a long period, finally get to the mikveh, and then, be due for your next period in a week and a half or a week. And that can be really stressful. But for many women, especially, the example you're giving is women who've had breast cancer, and that other contraception options are not an option for them. It absolutely could be worth it, and it could be their best option. It could be their best choice. So it really is an individual choice, and it really depends on your specific history, which one makes the most sense and which side effects you're willing to tolerate halachically and medically. But again, you're going to be really, really educated about the halachot of ketamim, of spotting. You're going to make sure that you're not declaring yourself a NIDA before you need to. So sometimes women start with a bit of a brown spotting, and as soon as anything, any non-white discharge comes along, they declare themselves a NIDA unnecessarily, right? When they're not actually, the spotting that they're saying might not actually be their period yet. So, it depends. You really want to talk to your yoetzet and your rabbi about your particular profile. Does it indicate reliably that your period is starting? It might have one status in that case as a vesed goof, but if it's just random spotting that sometimes happens, sometimes doesn't, you may be extending your NIDA status unnecessarily, unknowingly. So it's always really, really important to talk about your situation, your circumstances, and make sure that you are that you're following the halacha and not extending, unnecessarily.
And then I did want to talk about a few other non-contraceptive options, which are the barrier methods. So there are spermicides, condoms, male and female, diaphragm, sponges and caps, and then permanent sterilization. So, typically barrier methods are not halakhically not what we would like couples to use. Diaphragms, though, are something that couples can consider. Diaphragms are not as effective a method because they're not, it's a barrier method that is, it can work, but it doesn't always work. So diaphragms are typically combined with a spermicide. So it can be a good option for couples in certain situations, especially if there is already a subfertility, couples at the end of their fertile years who don't want to, have, any kind of hormones, temporary situations. So I think that is something that definitely can be discussed with your doctor. There is a new hormonal contraceptive on the market called Phexxi, which is not exactly a spermicide. It changes the pH of the vagina, and it can be combined with a spermicide and a diaphragm to increase the efficacy of this type of contraception. None of them are going to be as effective as hormonal or contraceptives or the IUD. However, I think it's important to understand these options. There are situations where all hormonal contraceptives are contraindicated for a woman, and a woman may not be able to use an IUD. So some of these may be options. If there's a situation where a condom is recommended, obviously it's important to talk to a halachic authority in terms of the specific situation for the couple.
Absolutely. So while we never say never, we certainly would not approach that as our first line of defense. But diaphragms, according to many, and certainly according to Nishmat's postgame, would be absolutely, equivalent halachically to an IUD, which is quite common. And really, although the pill is the peak, the epitome of an excellent birth control method, there are many reasons that the pill might not be appropriate for a woman. And in that case, we would absolutely turn to things like diaphragms and IUDs quite quickly. And the question that somebody asked about the short-term birth control, exactly as you said, it depends just how important it is for them to not get pregnant, just how important the efficacy is. But these kind of methods might also be a really good choice, depending on the circumstances.
And then I had another question. It says birth control pills make me depressed. What other options are there? So I think, when thinking about a question about, side effects, it's really important that we consider, what about the birth control pill is making that person depressed. And like we talked about before, there are estrogen and progesterone components of a birth control pill. And when we're thinking about those hormonal side effects, sometimes just changing the type of the pill can actually change the side effects. So like we showed in that original chart, there are birth control pills that have much less hormones than others. So I hesitate to make generalizations about all birth control pills, because even though a woman may have had side effects from one birth control pill and felt maybe some side effects from it, changing the formulation of the birth control pill may be a totally different response. So it's possible that a different estrogen progestin combination, she may feel differently. So it's possible that birth control pills may work for you, maybe just a different one. Maybe the NuvaRing would still work for you, even though you didn't like the combined birth control pills. Maybe the progesterone only pill would work. IUD, always a really good option if you don't like the fact that the pills had side effects, because the amount of hormone in the blood is much, much lower with the IUD.
Is it, when you said that when we sort of assume that an IUD is not really a great short-term option, is that because of the expense, or is that because of maybe the adjustment period could be long, so you're really risking a lot of spotting, or is there some other medical reason that it's?
I would say both. I mean, I've had patients who do it for 6 months. If they're willing to do that, there's just a little bit of pain involved in the procedure, and then you have to, take it out, and there's an adjustment period. But, if someone wants to do that for 6 months, that's fine. That's their choice.
And would you say that if a woman's had an IUD, let's say, before her last baby and now, or 2 babies ago, that you could assume that she'll react well, and maybe, even in the short term, it would be a good option, or your body changes so much that you really don't know how you'll react after a pregnancy?
Yeah, that's a good question. I mean, I think that the uterus does change in shape and size during your pregnancy, so it's definitely possible that the reaction will be different. But, typically if someone's had a good reaction to an IUD in the past, we would assume that they would, continue to have a good reaction. But I will say every woman's body is going to be different after every pregnancy. It's, how the uterus recovers, how the hormones recover, it can never be predicted. But we did get some questions about breastfeeding, which maybe is important to address. So a lot of people wanted to know what birth control pills or what contraceptives are recommended during breastfeeding. And typically, most contraceptives are fine during breastfeeding. Any progesterone only method is fine. So a lot of women will do the mini pill or the IUD for that reason. Breastfeeding is not a contraceptive. A lot of women wish it were. It can cause subfertility. So many women will not get their periods and will not get pregnant while they're breastfeeding, but some will. So if you're okay with that, then you don't need to be on contraception. But if you're not okay with it, then we do recommend a birth control pill. And that is a time when the mini pill can be a good option because you already have subfertility. So the mini pill can be a good option. And IUD also is a really good option. Now, birth control pills per se with estrogen and progesterone are not contraindicated in breastfeeding. The reason we don't recommend them first line is that the estrogen in the birth control pill can actually decrease milk supply. So for some women who have a copious milk supply, they're not worried about it, they can go on a regular birth control pill, especially if breastfeeding is already really well established. But for most women, we typically recommend a progesterone-only method so as not to interfere with that relationship. But if it's something that, you've breastfed for many times before, your milk supply is always great, you can even consider a combined birth control pill. It's just that we would typically recommend a progesterone-only method first, just to prevent any impact on the breastfeeding.
I would add halachically that the progesterone-only pill, certainly after the first few months when you're not necessarily exclusively breastfeeding anymore, can absolutely be a roller coaster where there's some spotting, and let's say the baby didn't nurse as much today or didn't sleep as well last night, and so absolutely you want to be really compliant about taking it at the exact same time of day. And after a certain point, if you see that it's just not working for you anymore, then hopefully breastfeeding is well established, and then you ask your doctor if maybe it's time to switch back to the combined pill. We did have a question that I didn't quite understand, and I'm wondering if whoever asked it could clarify. They said they would like to receive in typed form the names of these natural sources which were mentioned for hormone management. But I'm not sure what that's referring to.
Maybe what I mentioned as medications you could request from your doctor if you are having spotting or bleeding to add to the IUD would be my thought. So what I mentioned that you could ask your doctor would be adding a birth control pill. So any kind of birth control pill which contains estrogen and progesterone would be something that you could always add to an IUD to prevent spotting, or a type of synthetic progesterone. So some brand names for that would be either Provera or Agestin. Those are two different types of progesterones that your doctor could add to help stabilize the lining if there was a situation where you're having a lot of breakthrough bleeding. So if you're going to bring it up to your doctor, you could always just say birth control pill or progesterone, and they probably would know what you mean.
Thank you. Can I ask a final question? I know we're running low on time, but I often get questions from women who are sort of managing with their birth control, sort of not. And then we talk about things like vitamin B and diet and getting enough sleep. How effective are those things at actually stabilizing a pill or a cycle that's a bit off?
Yeah, that's a good question. I don't think that those play a huge role in the bleeding on a contraceptive. I wish that I could say that they did, but I really think it comes down to, how much progesterone and how much estrogen is the uterus being exposed to. And are the ovaries, ovulating? Are they developing follicles? And how much estrogen is actually being produced? So I think that I don't want to minimize the amount that women need to put into their self-care. I think that's very important for overall health. But I think when it comes down to spotting and bleeding, I think it's really just a amount of how, what is the effect of these hormones on the uterus. And I think adjusting those hormones often can be, it can be helpful. There is one more medication that we didn't really talk about, which can be useful for women who have abnormal bleeding. I don't typically use it in the setting of contraceptives because we don't combine them with contraceptives, but there is a medication called Lysteta is the brand name. It is a medication that can actually stop and slow down bleeding. So there are other medications that we have that can, help with bleeding if that's what women are having, so if there's other issues. But when it comes to bleeding on a birth control pill, I really attribute it to the hormones themselves that are, the issue. Now, there could be other medical problems like thyroid issues, diabetes, other things that contribute to how a woman processes these hormones. So definitely, a woman should always make sure that, she's getting a full checkup, getting maintenance, making sure that she's staying healthy, because those other hormones could play a role in bleeding in general, and sometimes those things can cause abnormal bleeding. So I wouldn't say necessarily like sleep and stress. I wish I could blame it, but I don't think so. But there are other hormonal issues that could play a role.
That makes a lot of sense. Thank you. One final question came in, but it's 9:59. I don't know if we can answer it in half a minute. The question was, are there any tips on tracking fertility naturally without contraceptives?
Yeah, so great question. And I always recommend using a fertility tracking or period tracking app, because that will really give you a nice, there are many of them online now, and they give you a nice, look at your cycle. So then it can be really helpful, I'm sure, for predicting NIDA, but can also be really helpful predicting ovulation. So if you know, when your fertile days are, then you can also match it up to when you're going to the mikvah to make sure that you are not going to the mikvah after you would have ovulated. And if you want to, you can even track your ovulation with ovulation predictor kits, where you buy them at the store, and then you can actually check to see when you're ovulating based on an LH surge. And that can be really helpful because then you know exactly when you're going to ovulate, because you always ovulate a day after the LH surge. So those can be really helpful. And actually, I've, in my practice, I've had patients identified who do ovulate, prior to going to the mikvah. And then when that happens, then, we can, help them by prolonging their cycles and, helping them, make sure that their fertile window ends up being, after their mikvah attendance. So that's a good question. And that's something that does come up a lot. But I think starting with the app and then adding on an ovulation kit are good places to start.
Thank you. I'm not sure if we're out of time, or that one more question just came in. I feel like it's such an opportunity to have you here, and I'm so grateful for it. We are so grateful for it, and I feel for the people on the chat who are asking. So in 2 words or less, I had an IUD for 3 months and took it out because it didn't stop bleeding, even with 2 weeks of estrogen pills. Do you think I took it out too early, or just best I took it out?
That's an interesting question. Every patient situation is obviously different. And it's really hard for me to comment on an individual case, but I think that, sometimes patients do have bleeding that doesn't respond to hormonal medication. So, an IUD is not for everybody. But I think there are some things that can be troubleshooted, but I think that sometimes it takes some different manipulations to see if it works. But again, like, the bleeding doesn't always resolve for everyone. So I think it's really hard to know in that situation. And sometimes I have had patients that take the IUD out because the bleeding doesn't resolve, but we are able to resolve it for a lot of women.
Thank you so much for squeezing that in, and thank you for allowing me to step in for Sarah. I'm definitely not happy that she's not feeling well, but I'm so glad that I got the opportunity to speak with you and to learn from you.
Thank you so much. I really appreciate you doing this on such a last-minute basis. It was amazing learning from you and talking with you, and I hope that everybody enjoyed our conversation on contraception. I know that I did, and I look forward to the rest of the conference too.
Same.